the faults and things that can go wrong with lumbar spine. Okay, so would you, Karen, would you mind lying on your side facing towards me, please? Okay, as I said before, a lot of this is about making sure that you set the patient up correctly. Everybody's got an individual preference about the couch height because it depends on how tall you are, how big the patient is, etc., etc. So basically, you have to try and be in a position, if you want to use long levers, you might want to use your knee. Sometimes if they're only very slightly built and you're a big guy or a big girl, you can actually manipulate them without using the long levers. But if you need to use the long levers, if they're very guarded or they're very stiff, you can use the levers and you don't have to use as much force. So the first thing I would do in this position is you want to make sure that they are more or less in the center of the couch, more so towards you rather than being further away. You're going to get them to place one hand on the hip there, like that, or just on the hip, right? And then this one, you're going to bend into here. Now, if you look at the lower leg, it's important because don't forget we were talking about making sure the facet joints are open and not closed. If somebody is lordotic here, with the leg straight down, they've got an arch in the back. If they've got an arch in the back, they're locking up the facet joints. Because the facet joints, as you start to lean backwards like this, is just locking up, right? So you want to open the back up. So by doing that, if you bring that leg towards you, like this, what you're doing now is flattening out the back. Yeah? So you can actually see it flatten. So when you pull that leg forward, what you're doing is affecting the pelvis, and the pelvis is twisting like this, which is actually flattening out the spine at the back. So you're opening up the facet joints, which makes it a lot easier to do. Okay? This one's going to sit in here like so. So what you've got with this one, I'm going to pull it through in a minute, but this one should be slightly hanging over the edge, because if you need to do a rotation and push down, it's no good if it hits the couch, it's going to go nowhere. You need it to drop into open space. Right, so this hand I'm going to take. Now when you pull this one through, what you're trying to do is create a rotation now. So what I'm doing is going to lock all the thoracics out by putting the twist in from the top, like I was talking about the towel. Twisting, twisting, twisting. I'm doing it from the top. So I'm going to use our shoulders to twist the upper spine by pulling it through. What you would normally do, you would place your hand through here and you would feel with your fingers. So you'd spread your fingers like so across a section of the back of the spine. And as you start to pull it through, you'll start to feel the tension coming in that finger, then that finger, then that finger as it starts to come down, right? And depending on which one you want to do, let's say you're working on this one, you wait, you feel that one, that one, that one, and then you think, right, I'll stop now. Because you don't want this one to lock up, this is the one you're going to manipulate, right? So you're feeling for that. This one, the way that goes forwards and backwards, and the rotation that you're going to do that will start to take it up from that point. So if I'm, with experience, I don't tend to do that because I know how far to take them, right? But generally, what we'll do is I will come through here. Now when you pull them through, don't pull them down here, so if you're in this position, because what you're doing, as you start to pull them down, it's going to affect the spine and it's going to do this. It's a totally rotational movement. So if it's a rotational movement, you need this arm at 90 degrees to the body, because when you pull, you want a proper twist, rather than pulling it down there and the head's coming towards you, right? So that's an important thing which people get wrong as well. They're in the wrong place when they pull them through. So from here, you're coming through, you take one hand on the shoulder, so ease that shoulder back and pull them through, okay? So you're in that position now. Hold on. Get back. Right. Hold on to your wrist. Right, now, in order to continue that twisty type of effect, you want the head to start off as well. So you want this, so turn your head towards there. So what you're doing is turning your head this way. So you start with the head to twist the spine that way. So everything starts to twist that way. It will feel reasonably uncomfortable because it's, they're in a twisted position. So they're going to hold on to that wrist, and then all you do, you place the hand, if you want to come around here and see what we're doing. So basically, again, like we said before, you're using the meaty part of this arm because you don't want to be pressing in with your elbow because it's quite uncomfortable. So I'm going to use my hand to slide through here. So I can feel with my fingers here, and then this bit, I rotate my elbow that way so the fatty part sits on there. So I'm actually coming across this section here. So I'm not pushing on the shoulder joints, so I'm coming through there. So I'm just holding that back and I'm palpating with my fingers. This one is going to come down and palpate on the other side. So I'm feeling the two segments above and below. So the bit in between is the bit that I'm going to manipulate, right? So again, when you start to do this, a lot of people dig with their elbow and pull them this way, and that really hurts them as well, so that makes them tense. So I'm rotating this, and the fatty part of this is now on the fatty part of her bum as well, right? So there shouldn't be any sharp bits poking in anyway, right? So you keep it nice and comfortable for them. So all I'm going to do from here, I'll try it first of all without using a long lever, is I'm going to roll her towards me, but keep this one back, right? So all I'm doing is locking up now, because you can't get anything until you lock. So think of a manipulation like you are flying a jet aircraft, okay? And you're not going to shoot your missile because it ain't going to land if you don't get lock. And they go, I'm locked, I'm locked. Okay, right, fire. And then you're going to get it. If you're not locked, you ain't going to hit, right? So think of the jet thing. So you've got to make sure that you get that lock, because the lock, you know that the missile then is going to hit its target once you've got lock and you've locked on. Okay, so you've got to lock first, just let it go nice and floppy. So you're locking in that position. As soon as I get it locked, then all it is taking it further and doing it. That's done. Okay, so it's a nice easy movement. So you just lock up, and the movement is a high velocity thrust. What they mean by that is that the velocity is very fast, right? But it only, sorry, the movement is very fast, but it only moves a tiny little bit. Because you haven't got a lot of movement, you've only got 1 degree at each segment. So you're only moving 1 degree, and that's all you're getting, right? So when you do it. So the secret is, the mistakes that people make is overlocking. Right, so all of it's locked up now, and it won't go. Right, so you've locked the whole lot up, it won't go. So that tiny little difference I've just done will stop it from working. Right, stop it from working. If you haven't got enough lock on, and you do it, they're going to go higher up. Right, because you haven't screwed them all the way down. So when you're looking at a towel, you can just relax now, Caroline, sorry. But when you're looking at a towel, this is the way it works. Hold on to that for me. Just keep that there, right? This towel is like your spine, okay? So if I want to now lock out, I start by turning it here. And I'm locking it from there. You can see it at the bottom starting to tighten up now, right? See down here, it's starting to get tighter. And it comes down, starts to tighten, and eventually it stops moving down the bottom, and then it starts to translate. So eventually you get it tighter and tighter and tighter, and what it does, it moves up. You can either do it from the top, or you can do it from the bottom, so you can start to, the idea is now that's totally locked up, it's not going to go anywhere. So you've got to release it, so you see the way I do that now, it's released it here now. So that's where you want to get it. So the more you tighten it up, the more it can go past the point that you want and lock it up. So we'll try now on somebody else. Caroline, can you just lie on your back for me? Okay. The dog, which is the one that Sat demonstrated, is not an easy technique to do, right? It looks easy, and once you've got it, it's simple, right? It's so easy. But to actually do it, I don't know how you did. Did you find it easy when you first started doing it?
Yeah, it was difficult to. It was difficult at the start, because like sometimes you just felt as though you were just bouncing off the patient.
Exactly. Well, I mean, when I first did it, I nearly gave up the course because I just couldn't do it. I really couldn't do it that first day, and I was struggling. The problem is when you're teaching it, they can't see what's going on underneath because you know the patient's lying on top of your hand, so they can't really see and imagine what's going on. So it's about trying to, so this technique is probably the hardest one of the lot really, although it's the simplest. It's about feeling. You know when it's in the right place, you know when it's going to go. But to teach that, it is so difficult to be able to do. But fundamentally what you're looking at is different things. So if she was quite kyphotic, right, and had got quite a bend in her back, some people lift them at the back, don't they? They lift the head up, yeah, to try and get some flexion in. It's much easier to do that. Use the couch, right? You won't, her now, she's got a bend in the back, and all of them facets have been opened up now, right? So you can do it that way. So use the couch. The couch is there. You can move in different places, so you can do that when you're doing dogs. So you might want to do different things with it. So we're going to start off. I want you to turn on to that side for me. Who's going to have a go first? Cherry.
Or,
Yeah. Lumbar roll.
okay.
So just follow what I said earlier. So first of all, you've got to set her up. The most important thing is to get it into the middle of the couch and just set it up properly first.
So, right.
You haven't got to teach us anything, just do as...
Now straight this leg. Yes, fine. Okay. Yeah. So I'm not going to do anything, just put the position in. Right. Put the hand on my hip. And in. Right. Okay. And then hold on to
Get a hold on to the wrist.
hold on to the wrist. Yeah. Just bring out a bit.
Pull it towards you first, so that's it. That's it. So you start to roll them halfway. Then this one keeps it down flat.
Right. Oh, it's gone.
Gone already?
Yeah.
Yeah, okay, well done. Yeah, go, yeah?
Very good, yes.
Yeah, well done, well done. So that's your first stage for you. Well, it's not your first stage, Chris. Yeah, it's very good. So that one's a success. Okay, you're finished now, so you've been done.
Oh, good.
Right? Okay. So basically, we haven't done the dorsals, have we, on you? So we'll do. We've got that to come, but we haven't got the dorsals. Okay. So we need another model. Stephanie. Okay.
Should I just be in my shorts or over there?
Now as you are, you're fine. So I want you to lie on your side, please, and we're going to do you.
Yeah? Lumbar roll again?
Yeah, lumbar roll
Yeah,
again.
that's
Exactly
fine.
what Cherry just did.
That's fine.
Have you ever done any before?
No.
This is your first one. Be
Yeah.
gentle. So when you're grabbing the ankle, try and be kind. Don't just rip the ankle in your hand. Because don't forget, you're not handling a piece of meat. You're handling the patient. So think about being careful. Sorry.
Okay.
Sorry,
What?
So, tell them what you're doing.
Hold on to that wrist for me.
That's it.
Okay, and
Instruct the
see
patient.
like that.
Instruct the patient. Right.
Come in. Oh, yeah.
Try and keep it rather than on the shoulder joint. Keep it in the soft
There.
bit.
There.
Yeah.
Roll me first, then push it back to
Yeah.
the
So
couch.
roller first.
Yeah, yeah.
Right.
Then
Well,
push
keep
it
rolling.
down.
Keep rolling.
Then push down to my shoulder. Yeah, okay. Yeah, okay.
Go on.
Hold that
Loads
there.
ago now.
Hold that there and roll me more.
You've got to put a twist into it.
There.
Twist. Go.
Yeah,
Oh, I
there.
can't.
There.
Okay, three.
Just go.
I can't.
No, because you bounced off it. You were almost on it.
Hang on.
You bounced off it.
Come off. Come off. So stay here. Okay. So what you do with this one, right there, when you get to this position, right, come around here so you can see. When you get to this position, the idea, what you're trying to do is a twist,
Yeah.
right? Because you're trying to gap those facets. You're trying to twist. So from this position, you're trying to bring them forward. Now, if you haven't got that sort of off,
Yeah.
that business, you can
Use
use
the leg.
a lever. Now, when you do this is really important when you do this. So many people I see putting the leg in the wrong place. Your knee should sit in the V of their knee because you're trying to use a long lever, right? Trying to use a long lever. So fundamentally what you're trying to do is to keep that way and push this one that way. So you're trying to create a twisting movement to gap that joint. That's all you're trying to do, right? If they've got long arms, some people have got long arms, you might need them to hold further up the arm, like that, so that you get more of a lock on them. So it's easy to do, right? So that's going to come into there like that, nice and loose. So from there, so when you come this position, you just roll them so they're nearly off the couch,
Okay.
right? So therefore they're halfway there before you do anything. Then that one's taken back. She's fighting all the time, not because she's
No, just because my thoracic's so hit into this. Fine, I'm good, I'm good.
okay. Because you can feel her twitching and not doing it. Now, one of the things that I find as well with patients is when you try to take a joint, which is what we're trying to do, further than its normal range, right? The first thing the patient will do as an automatic reaction, they will resist that movement. They will tense up, right? Now, they're expecting you to do something to them, so they're waiting for it. The worst thing you can do, is to say breathe in and breathe out, right? Because they know when it's coming then, right? So what I would normally do is I would feel for when they're breathing in and out. And if they're holding the breath, I'll just wait. Because there's only a matter of time they've got to come up for air, right? So that they can hold the breath and think like this, and they're just waiting for it, and I'll just wait, like that, and I'll be patient, I'll go, and then they go, like that, and I'll go back, and then I'll do it. because you can tell when they're holding the breath and if they're struggling. So really what you're trying to do is to make sure that you get this to get it right. So another thing that you can do is if they are guarding, right? Okay. Right, sorry. If they are guarding, right, then you can do a double one. So the first one is a pretend. So they resist the first one, then thinking, that's it. Then all of a sudden you get them again before they realise, oh shit, because they were relaxed, you right? So basically the second one is the one you're going for. The first one's a pretend one. So it's like a boxing. You throw a pretend punch and then their hands come up and then you hit them with the other one, right? So you've got to try and fool them sometimes to get over this guard, and you can do it twice. Okay, so back again.
So should I have it lower as well, the bed, or
It's up to you.
like? Do you get more?
If you
If
want
you
to
got it lower, you don't have to put your leg up like this. So.
Because I feel like it would be a bit better.
Yeah.
Like that, and then.
Try and put a twist into her. Keep it down. Just twist her in half. Try and break her in half. Okay. Put your knee up. Now keep it just gently, and the movement. It's like kick-starting a car.
Oh my
Just
God, I
push
don't
down.
know.
Just go.
With just my